Welcome everyone to today's webinar on COVID-19 sick leave abuse and reasonable accommodation requirements presented by Barclay Damon. Many thanks to our presenter Michael Sciotti for being with us today and to all of the participants who have joined in. Please note this webinar is being recorded to share what we learned with the business community. Michael will share his presentation with you, then follow with ample time for questions and discussion. Please use the chat to submit any questions during the presentation. And just a reminder, when others are speaking, please keep your audio on mute to minimize background noise. With that said, I'll turn it over to Mike to start things off.
Great. Good morning, everyone. I'm Michael Sciotti. I'm a partner at Barclay Damon. I'm primarily situated in Syracuse. I put my contact information on the screen for you. Today, we're going to talk about COVID-19 sick leave abuse and the reasonable accommodation requirements. Funny thing, I already got a question before the presentation. Someone looked through the slides and said, I don't see anything about the sick leave abuse. I'm going to talk to you about the sick leave abuse and the various scenarios that come up. The way to beat the sick leave abuse is with the allowable inquiries that you are allowed to make as an employer under the Americans with Disabilities Act and the New York State Human Rights Law. So your defense is the ADA. Your ability to outsmart an employee who thinks they're being smart is the ADA and what you are allowed to do and what you are not allowed to do. You know, some of the things that we are seeing now that we're, 6-7 months into this, we see individuals calling in sick, saying they're going to the doctor, saying they know someone that knows someone and they were in contact with them for 20 seconds and they can't come in today. We see individuals who are in fear of coming in because they fear they may be infected. We see individuals who are asymptomatic, they're probably working at home. We see individuals violating the state of New York's executive orders on travel, both internal and external to the U.S. You can fire an individual for violating a New York State executive order. It is a legitimate business reason. And if they do so, you are free to terminate or otherwise discipline them if that is your prerogative. We're seeing employees lying where they are. I'm going to the doctors and oh my God, they forgot they were friends with you on social media and they post something on social media that suggests they're doing something else. Can I act on that? Of course you can act on that. We see individuals voluntarily quarantining themselves when there's no need to do so. The biggest thing we are seeing, and I knew it was going to be a problem, is the objection to going into work. They want to continue to work from home. Some of you are, depending on where you are in the state, we're dealing with typically a 50% occupancy that you can have at work. Some of you are allowing your employees to continue to work at home. Some of you are insisting that they come back in. The employee that is directed to come back in has the right to say, time out, I have a disability, it is this medical condition. I would like to continue to work from home in whole or in part, and you're going to have to run the reasonable accommodation process in that regard. The biggest thing I want you aware of is that the ADA is your friend. It is a powerful tool if used correctly by an employer to call an employee out on potential misuse. You always have the right to say to an employee, why aren't you here? I've directed you to show. Don't be afraid to terminate an employee. All I ask is that you build the documentation and that you have proper documentation. One of my employers just ran into the following problem. They were going to fire the individual at the end of their busy season, which is the end of September. In the interim, the employee asked for COVID leave under federal law to care for their child because of school issues. So now they're confronted with, well, what do we do? Yeah, you're damned if you do, you're damned if you don't. they've already asked for the COVID leave and they're entitled to it. You can terminate someone on COVID leave if you can prove that you would have terminated them anyway. So one of the things here is be quick to act in an abuse case. Don't let the employee recover. Feel free. Make sure you document. I need the documentation. Documentation comes in lots of forms. It could be a verbal warning, a written warning. It could be an email exchange. It could be that Facebook post. And I would encourage you, if you're grabbing things off an employee's Facebook or other social media, you get it as quick as you can. And I want all the comments. I want all the little thumbs up and smiley faces. I want to know who said what. Because 10 minutes later, it could be gone. And many employers are missing the opportunity because they failed to grab what was on social media. Okay, so a couple things we're going to talk about as we get through this concept of abuse here by employees. And one of the things, let me just take a step back. This is a trust but verify world. The abuse people are the ones that won't verify, all right? They simply just don't verify. That is the majority. And then some of them are producing fake medical notes. Can I call up the physician to determine the authenticity of the medical note or the healthcare provider? Yes, you can. Did you really write this? Did you really give this scribbly note here that I can't read? I swear to God, they're taught in medical school to write notes so that no human being can read them. So the one that pushes back, the one that says, keeps coming up with an excuse why they don't have verification, draw the line in the sand and say, you get us that verification by such and such a date and such time, or else. And we can decide what the or else is going to be. A few things here. Number one, job descriptions we're going to go through. One of the things you need to be aware of is a good job description is a good defensive document to an employee claim. If they need to work in the office 80% of the time, make sure your job description is crafted in such a manner. In-person supervision, in-office work. You know, make sure you highlight that in this day and age in that regard. So we're going to talk a little bit about the do's and don'ts of job descriptions. I do want the job description signed and dated by the employee, and to the extent you revise them because of this presentation or otherwise because of COVID-19, please go ahead and have them sign a new one. If the employee refuses to sign, you give it to them anyways. And you write a little note, Johnny Jones refused to sign on such and such a date, and you put it in his personnel file. We're going to talk about the reasonable accommodation process generally, and then we'll bring it home a little bit in COVID-19. And I broke it up this way because I want you to see it's not really different. It is really the same, and we need to make you realize that you can ask the tough questions of an employee. Many employers are very hesitant to ask the tough questions. Remember, we are now way beyond the overwhelmed mode of the state of New York. Back in March and April and even into May, you know, healthcare providers were overwhelmed. We're no longer there. We seem to have it under control in this state, while other states are having a problem. And I want you just to keep in mind the reality on the ground. The reality on the ground is, hey, look, it's, I don't want to say it's business as usual, but we're close to business as usual in this state, given where we were back in March and April. Of course, we got a ways to go, and I need you to be a little more flexible as an employer. Another concept, please remember, if you're going to fire them, get rid of them sooner rather than later. I am seeing consistent problems with employers waiting. And then the employee engages in what is in essence protected activity. So that's really where we're going to go. We'll start with the job descriptions in a second. I have some golden rules. Number one, enforce your policies on a consistent basis. Training of managers, owners, and non-management officials. and a properly drafted employee handbook or policy which is distributed and followed. Now, you should have in place, or I'm assuming most of you have in place, some type of travel policy where the employees should tell you where they're going on vacation. You have to do the screening. You have to do the tracing. We need to know where they've been. And if an employee refuses to answer the question or refuses to tell you where they've been, you're going to be allowed to discipline that employee. They're going to have to answer the questions at the end of the day. I have one employer that went so far as to say, if you were going to one of the states that the state of New York has said is off limits and you come back and you have to quarantine, the employer was not allowing the employee to use their vacation time to travel to that state. We opinion it was legal based on the state's executive order. So there's a lot you can do. You just have to you just have to be smart about it. I want you to be proactive as opposed to reactive in this area. It's very important to me that you challenge the employee that calls in sick or doesn't show. Why aren't you in work? What is the reason? And if the reason is a bunch of bunk, I want you calling them out on it. I want you documenting it. I want you, if you're going to warn them, terminate them, or whatever. Don't be shy. Why are you not here? I want to know. In that regard. And if they're silly enough to have an open Facebook page or an Instagram page or something like that, go take a look. And maybe they're going to tell you where they really are in that regard. Okay, so let's talk a little bit about the job descriptions. Job descriptions, when properly prepared and implemented, are a defensive tool for employers. One of the things I also always like to put in there, racial requirements are never lawful and should not be used in most job descriptions. There are a few cases where you are allowed to discriminate, like religious organizations. If you're going to hire a CFO, if you're going to hire a CFO, can I make the CFO mandatory that they're Catholic if I'm a Catholic organization? Sure. Can I mandate that the if I'm the NAACP that the executive director is African American? Absolutely. These are called bona fide occupational qualifications, and they exist, and you are allowed to do so. One of the things I want you to divide in a job description is major and minor functions. It's very important in that regard. Basically, what are the things they must be able to do, and what are the things that are tangential, the minor things that they do. The major ones are most likely going to be deemed essential job functions. The minor ones probably will not be, because they're infrequent in that regard. And I gave you a couple examples here. Some of the slides are set up. I'm not going to read them to you. Some I will, most I won't. There's more detail in the slides if you want to go into it. I'm just trying to give you the summary so you can implement. So again, the thrust here on the job descriptions, especially in the COVID-19 world, once we're back to business as usual, do you want the person to work in the office? You have to craft a job description that it accurately justifies that at the end of the day. Okay. Please remember, job descriptions are not required. I am simply saying I think they're a good defensive mechanism. You also want to make sure they're properly developed in that regard. And remember, if you have a written job description, you must maintain them as part of record retention requirements. Okay, so enough with the job description. Let's talk a little bit about reasonable accommodation requests. Now, one of the things I want you to realize. Sometimes we're dealing with an abuse situation and the employee just throws something out. Well, I have a heart condition and I have asthma, and therefore I want to work at home, or I'm not coming in today, and my doctor told me to stay at home. You are free to call them out on all of those things, and I would tell you to call them out. You're going to run into situations that are legitimate, reasonable accommodation requests, and you're going to quickly figure out where some are not in that regard. So again, you are allowed to call them out. This is the single largest problem that we have. Employers not calling them out, employees out. And the second problem we have is employers who know they're getting scammed. You don't want to do anything about it because you don't want to terminate the person in that regard. I can't help you. If you don't want to terminate them, that's up to you. Remember, you can verbally warn them, written warn, you can do a suspension without pay. But if you know they're scamming you and you have proof they're scamming you, you are free to terminate. If you don't want to terminate, that is up to you. You can do something less. But handling the actual request, the single greatest request that we are seeing or are going to see is, I want to work at home. Step one is a job description to combat that based on reality. You get the person, you put in essential functions, the major functions that ground the person in the office. Maybe not all the time. You know, I think we'd all agree that you would prefer the person to be in the office, but do they have to be in 100% of the time? Maybe the compromise is, we need you in the office 80% of the time. This other 20% of this stuff, you can do at home. That is totally fine. Every position is a little different. So the first thing you always have to decide is, am I covered by the Americans with Disability, the ADA, I'm sorry, the Americans with Disabilities Act. You typically have to have 15 or more employees in each working day for 20 or more calendar weeks in this year or last year. It's an employee count. We take out your payroll records. It covers employees and not independent contractors. Under federal law, it's only liability to the employer, not any of the supervisors. Under state law, basically it's the same test. You got one employee, you're going to be covered. The big difference under the human rights law is it's corporate and individual liability. So supervisors, managers can be sued under state law for violations of the human rights law. So keep those in mind. My guess is you're covered by one or both. It's basically going to be the same procedure under either. Please remember, your employee handbook is your front line of defense, both with any COVID policies that you may have, and second, with your reasonable accommodation policy. As you're about to see in a moment, New York State mandates that employers have a reasonable accommodation policy. In that regard, the state of New York has a sample one. I like parts of it, don't like all of it. If you would like a copy of the state's policy, feel free to email me in that regard, and I'll send it to you, send you the link. Again, under state law, must have a reasonable accommodation policy. Now, one of the things I always like to talk before I get into the specifics of the procedure is illegal use of drugs. The ADA indicates that an individual with a disability does not include an individual who is currently engaging in the illegal use of drugs. There's a lot to that, but that is the general rule. The ADA does protect the following three classes of individuals. The key is they're not using and they completed a drug rehab program. They're not using and they rehab themselves. They're not using and they're in a rehab program. The key there is what? They're not using. And the fourth one is the perceived drug user. You have somebody that you know that's like this. You think they're a druggie, you think they're high, but they're not. That's just how they are. That person is protected by the ADA. The key when you discipline someone who's abusing because of COVID, they're calling in, they're saying they're going to the doctor, they're violating a state's executive order. The key is in essence, you write them up, you have your proof, and then you act on it. That is the absolute key for me, is aggressive discipline, is aggressive documentation, and call them out. And what if we can't get a hold of them? What if Johnny is not calling us back? He's not showing for a shift. Don't go crazy. No call, no show, terminated. All right. Don't think you can't do that in today's world. You can. One of the things I would be remiss if I didn't say, if you are an employer, don't violate the state's executive orders. We have seen that. They're all over employers who are violating the executive orders at the end of the day. Your employee has a claim in that regard, so make sure you do not, if you are the employer, violate the executive order. There are certain exclusions under the ADA. I've listed them here. These conditions, I'll refer to them for lack of a better term, are not disabilities under federal law. Some of them may be disabilities under state law. It simply depends. We have three main areas of concern here. Remember, the accommodation request is as follows. Mike, I want to work at home because, and they list the because, and let's assume it's a medical condition. If it is, I need to take care of my kid because they're remote learning, that's going to be a Family First Coronavirus Response Act leave situation, not necessarily a disability. In prior webinars, we've gone over the New York State COVID leave law, and another webinar, a couple different webinars, we went over the Family First Coronavirus Response Act in detail. The only update that I have to the Family First Coronavirus Response Act is we had a case that came out of New York City. The state of New York sued the Department of Labor, and some of the Department of Labor's regulations have been struck down. The definition of a healthcare provider has been struck down, is overly broad. The work availability rule has been struck down. The intermittent leave and documentation rules have all been struck down under Family First Coronavirus. We are waiting to see what the U.S. Department of Labor is going to do. I have not checked this week to see if they have appealed. Their appeal time just started to run. Another option or actually is issuing emergency regulations in that regard. Our advice is to stay the course, keep the Family First Coronavirus Response Act, keep granting or denying the leave and keeping the records as indicated in the regulations until we see where the Department of Labor or the Second Circuit, or probably it's going to end up at the U.S. Supreme Court. Okay, so let's take a step back now. I want to work at home because I have a disability. The request is either going to be A, yes, you do, and we're going to run the process, or they just threw that out. They threw it out there as a red herring to try to make you back off. You embrace it. You go move forward in the process with the employee, and you call them out on it. I can't tell you I have a heart condition and then tell you I'm not going to prove it to you. I can't tell you as an employee that I have asthma and then not give you the medical documentation to support it. I can't tell you that I will not give a letter to my physician that you give me so that you can have answered a series of questions relative to the employee's medical condition. The ADA is a powerful tool. It is an employer tool. And most individuals don't realize that. Most employers don't realize that. The main areas of concern are going to be, what is a disability-related inquiry? What is a medical examination? And then just a general discussion of the reasonable accommodation process. There's three potential timing of the inquiry here. Pre-offer, before you offer an employee a condition. Generally speaking, you can't do any disability-related inquiries or medical exams. Post-offer, pre-work, you can basically do whatever you want, as long as you do so for everyone in the same job classification. The ones we're going to be confronted with here are the last one, during employment, and that's where we're going to spend our time discussing it, but I would be remiss if I didn't point out the others. Okay, again, the first stage, generally can't do disability-related inquiries in medical exams. Mike, what about drug testing? Drug testing is not a medical exam. It is specifically excluded as such. Okay, what if I'm interviewing an applicant, they have an obvious disability? Can I ask how they're going to do it, whether they would need a specific reasonable accommodation? Sure you can, but then if you exclude them, you're going to have to make sure it's job related and consistent with business necessity. The second stage, and again, I don't want to spend a lot of time on the first two, is in essence, I've given them a conditional offer. They must pass a medical exam, a background check, a criminal conviction check, whatever it's going to be. What can I ask during that medical exam? Almost anything you want, as long as you do the same set of questions for everyone in the same position that you're hiring. Most employers don't do that, but it is a powerful tool in case you wanted to. Okay, now the third stage, this is where we're at. Johnny, I need to work at home because I have asthma. Remember, the ADA and the human rights law are dealing with the individual's own disability. It does not go to, my son is sick, my son is home from school, I have to care for my mother. That may implicate the Family First coronavirus, that may implicate FEMLA, but it does not indicate the ADA or the human rights law. We are solely dealing with the individual employee's disability in that regard. And the employee, once they open the door, they've opened the door in that regard. We have seen employees who were shocked that the employer followed up with them and wanted proof of their disability. They then turn around and withdraw their request. Why? Because they've lied to you about it. They don't have it. Can I proceed? I think you can. And say, wait a minute, you've asked me for a reasonable accommodation. You've informed me you're disabled. I am allowed now as the employer to follow through with that reasonable accommodation request and to see where we are. They're going to fight you tooth and nail. But sometimes, you don't have to grant the accommodation to allow the employee to work at home because they have asthma and they're more likely susceptible to get COVID-19. I'm not sure I want that person in work now that I've known that, unless I have some medical documentation to figure out exactly what is going on. Reasonable accommodations, I want you aware of this, sometimes end in termination of employment, even if the person really has a medical condition. We go through the reasonable accommodation process. You as an employer determine there is no reasonable accommodation that would allow the employee to perform the essential functions of their job. What do? We have no other job for them to do. There's no other job that they're qualified to do. I can't reasonably accommodate them. You terminate them. And employers are sometimes surprised when I say that, and don't be. You don't have to take away essential functions of the job. You just have to grant reasonable accommodations, which would allow them to do the essential function of the job. So what is job related and consistent with business necessity? This means that you must have a reasonable belief based on objective evidence that the employee's ability to perform the essential functions of the job will be impaired by a medical condition, or the employee poses a direct threat due to their medical condition. It could be a direct threat to the public. It could be a direct threat to the employee themselves. We are in a pandemic situation, unlike we have ever seen during any of our lifetimes. We are dealing with a direct threat situation. So if an employee truly has an underlying medical condition and truly is susceptible to getting COVID-19, I am allowed to go down the path of reasonable accommodations with the employees. Some employees want to come to work for the socialization. Can I tell them you have to do your work at home? Yes, you can. That you're well within your rights to do that. No, I want to come in. I like being with everyone. I live alone home by myself. It's not so much fun, but I'd like to come in. You are free to say no. You're going to do your job at home. What if, because of the pandemic, I don't have any work for these individuals? Lay them off. They'll get their unemployment benefit. You can furlough them so they can stay on your benefits as long as your benefit providers allow it. But we are in a direct threat situation with COVID-19 in that regard. So the ADA is going to prohibit you as an employer from asking disability-related and medical or conducting a medical exam if it is not job-related and consistent with business necessity. So we're going to go through some examples here. And some of these slides I'm jumping, I've already mentioned. What is a disability-related inquiry? I've given you a list here that the EEOC has provided us, asking an employee whether they're disabled, asking an employee to provide documentation about their disability, asking an employee's coworkers, family members, doctors about the employee's disability, asking about genetic information. I'm not saying you can't do it. I'm simply saying you can do it if it is job related and consistent with business necessity, all of which are on a case-by-case basis. Can I ask about workers' compensation history? Maybe. Generally speaking, it is something you can't inquire about in certain cases. Can I ask what prescription meds you are taking? Sure. If it's a question of safety, if it's a question of can they do their job, you absolutely can. The key with an ADA inquiry is not to go overbroad. And let me give you a quick example. Can I have an employment policy that says, you must tell us if you're taking any prescription or non-prescription medication which impact your ability to safely perform the essential functions of the job? You must tell us in that case. Absolutely. That is a legal employment policy. Can I ask this question? Put this in writing. You must tell us what prescription medications you are on. No, you cannot. It's overbroad. That's going to give you Viagra. That's going to give you birth control. And those are overbroad questions. So the key in this whole situation is to take baby steps. And I'm going to fast forward a little bit. At the end of this section, I'm going to give you a website to access. It will walk you through all of the the vast majority of disabilities that are out there and the reasonable accommodations, what you as an employer should ask for by way of documentation. It's called the Job Accommodation Network, and I'll show you that in a few minutes. Permitted questions, asking employees how you're feeling. Asking an employee whether they're sneezing or coughing, whether they have cold or allergies. asking employees about non-disabled related impairments, like they break your leg or something like that. They break their leg, I'm sorry. And asking an employee whether they can perform the essential functions of the job. Can I keep an employee at home or send an employee home if they're sick? Yeah. Can I prevent an employee from coming in? They failed the screening questions. Absolutely, you're required to do that. Where we're running into problems, and in some situations, there's really no way to combat it, is that an employee says, no, I got a fever today. Can't come in. I'm violating I'm at 102. Some employers want to make them go to the doctors. You know, I don't know if you can make someone go to the doctor to verify for one day they had a fever of 102. Some are doing it and what have you. I question whether you can. Next day they're fine. What was it? Was it a 24-hour bug that ran its course? Is it COVID-19? Is it something else? And I'm going to require a medical release authorization before you can return to work. That may be okay under the circumstances because we are in a pandemic and a direct threat. The key here is you realize every situation is unique. The law requires you to analyze every case, every situation on an individualized basis, one at a time, based on the individual facts and circumstances of the case. Some other questions that really go towards conduct and discipline. Have you been drinking? Have you been using illegal drugs? Asking a pregnant female how they're feeling when their baby is due, that's totally fine. And asking for emergency contact information. Always ask for emergency contact information after you've hired the employee. There are a number of procedures and tests that are not medical exams: drug use, physical agility tests, tests to evaluate the employee's ability to read and distinguish colors and labels. Psychological tests and polygraph exams will not fall within the purview of what is a medical exam. Some more information on job-related and consistent with business necessity. You know, I do yearly physicals. Am I allowed to do those? Sure you are. If you do them for everyone in the same position, there's no problem in that regard. And remember, when an employee tells you have a medical condition, you can follow up and you drive it to ground. But remember what I said, baby steps. We take baby steps. You know, the first thing typically is asking the employee a series of questions. Take this letter, go to your healthcare provider and give us answer to these questions so we know what it's about. Sometimes the healthcare providers refuse to give the documentation. They refuse to answer the questions. What is our response as an employer? You deny the accommodation. If the healthcare provider refuses to cooperate or the employee refuses to cooperate with a reasonable accommodation request, can I deny the request? Yes. I would build a record, you know, 3 strikes and you out. I called the doctor's office 3 times. They refused to return my calls. You document the date and the time of the call. That's good. It's all set in that regard. When an employee, and one of the things you must walk away from this presentation with is when an employee asks for help, how can I help you should be the response of you and the supervisor. I don't want you immediately suspecting that this is a fraudulent request, that this is an abuse in that regard. I want you to be sympathetic. I want you to be nice. I want you to be all those things. And remember, trust but verify. You're allowed to ask questions. Why aren't you in the office today? I have a fever of 102. Are you going to the doctors? Yes or no? Not sure yet. Well, we recommend that you go because we're going to ask for medical clearance before you come back, given that you have a COVID-19 symptom in that regard. Remember, baby steps, reasonable requests. How can I help you? Be sympathetic, be nice, and know when to turn up the heat. You know when you're getting jerked around. They don't return your phone calls. You can discipline them for not returning your phone calls. They don't return their emails, the text messages, however you're communicating with them. You can discipline them for that. They're going to have an excuse for everything. My power was out, my computer was broken, my cell phone died. Just prepare yourself for that. Well, why didn't you call and tell us that? It can be the response. But remember, you can be aggressive in this area. If there are multiple accommodations which would allow the employee to conduct the essential function of the job, who gets to pick? Is it the employer or the employee? It's the employer. The U.S. Supreme Court has said so in that regard. Here are some examples of reasonable accommodations. They're really just tied into, these are very general. It simply depends on what we're dealing with and what the request is. This is absolutely key. All decisions are made on a case-by-case basis. You don't group together, you don't stereotype a reasonable accommodation request. Please remember, it's important that you document all reasonable accommodation communications. One, you're required to, and two, you're practically going to need them if you're sued for disability discrimination. Remember, in our COVID-19 world, it is very easy in the state of New York for an employee to complain against the employer. They have set up an online complaint procedure. The employee basically types in the information, and then you have to respond to someone from the state of New York. It might be a phone call from the New York State Attorney General. Could be a visit from a Department of Labor or Department of Health official. We simply don't know. It depends on the facts, but you need to do this, and you need to consider case-by-case basis extremely important. I mentioned the Job Accommodation Network. Here is the website. If Johnny says his underlying condition is asthma or a heart condition or cancer or something that makes him more likely to get COVID-19, and he requests to work at home, what questions should I ask him? You go to this Job Accommodation Network. They have already prepared on their website about 100 different disabilities and medical conditions that you can simply click in. It will explain the medical condition. It will explain the limitations the medical condition provides, and it will give you a list of questions that you should ask the employee and or their physician. They've really made it nice and easy for you. There's a second site on here, the ADA National Network. I've given you that website as well. I find the Job Accommodation Network to be superior, and typically I don't need to go past that. If you have specific questions about a medical condition in COVID-19, call the Job Accommodation Network. I've given you their phone number. They are there to help you. They are there to help guide you through the reasonable accommodation process. They may even tell you if the employee says X, Y, and Z, that doesn't make much sense. Those aren't conditions associated with the medical condition. So use this resource. It's very important at the end of the day. So let's tie it up now in the next half hour or so with some specific COVID-19 issues. Again, I think the single greatest thing you're going to see here is I want to keep working at home. You know, and if it's a medical condition, we have to run this reasonable accommodation process. You can let them work at home in whole or in part or not at all, depending on the outcome of your reasonable accommodation analysis. Remember your job description. It is your front line of defense. Remember your reasonable accommodation policy, which you must have under state law, and don't violate any of your procedures. If the employee asks for leave to accommodate a school child at home, that's not a reasonable accommodation request. That is a Family First Coronavirus Response Act leave issue. It could also be if I need to care for someone else. Maybe it's a COVID situation, maybe it's not COVID, might also be a FEMLA situation. Please remember, one size does not fit all in this area. So I have this medical condition and I want to work at home, or the employee just could be lying to you. You know, a couple things I've already mentioned. The employee violates the travel policy. I can or the New York State's travel ban. They go to a state and come back and they say, oh, how do we know what states are on the list? You have to look every day. They've been updating it, and we basically are going to have to analyze on a case-by-case basis to get the analysis. So let's jump into some COVID-19 issues. The EEOC has published some technical assistance to help you during the pandemic. What most people forget is we had another pandemic like 7 years ago. The H1, I'm sorry, I forgot, not the H1N1. You know, there was some guidance published. They've updated it a little bit. Basically, it says what information may an employer request from an employee who calls in sick in order to protect the rest of the workplace. And it's very pro-employer. You're always allowed to ask, why aren't you at work? It also addresses taking the body temperature, which you are going to be able to do in that regard. It allows you to direct employees to stay at home if they have symptoms. And you know, one of the things you can also dictate before you come back to work, not that you get a COVID test, is that you get medical clearance in that regard, because you did have symptoms in that regard. So getting these notes to return to duty, the fitness for duty becomes et cetera. We all know what a pandemic is at this point. They've given us some information on it and some background in that regard. We're all familiar at this point with HHS, CDC, and the World Health Organization in that regard. And basically, some of the guidance here issued by the feds relates to pandemic planning. Yeah, it'll be helpful for hopefully the next time around. The EEOC in COVID-19 adopts the general ADA framework that I went through. All right, there's nothing special because it's COVID-19 related. The EEOC has confirmed that with this guidance, run the analysis the way I described in the last section. And you'll see here in this guidance that we're going to go through, it adopts, in some cases, word per word, the general guidance that I went through a few minutes ago. Remember, health and safety is a great defense, direct threat, not allowing an employee back to work. Another question that I've gotten quite a bit, I have no work for the employee to do at home. And, you know, they can't be in the office because of their medical condition and their doctors taking them out. This may be a layoff situation. If you have no work for them to do, it's probably a layoff situation in that regard. Maybe a leave situation under Families First, depending on the specifics and how big you are. So just keep all those concepts in mind. You are also, one of the things I have not mentioned yet is the defense to a reasonable accommodation request called undue hardship. Undue hardship may be a defense. you know, we had someone who was hearing impaired, but could read lips. And the employer is mandating everyone walk around with a face mask. But the person is hearing impaired and needs to see the lips. Do you know that there are face masks which you can get that are clear and will meet health and safety standards? That could be the reasonable accommodation when the employee says, I need my supervisor, the people I'm interacting with, to wear a face mask that is clear so that I can see what they're saying, because I can't hear them. That's reasonable, folks. And the cost is a little more, but it's not astronomical in that regard. Undue hardship defense based on cost, it better be a heck of a lot of money. Not a few $1,000s, a heck of a lot of money in that regard. What is disability related? I went over that in the last section. The EEOC, when it comes to the COVID-19 rules, has adopted in whole the analysis that I went through in that regard. And so those rules I went over, what is a disability related inquiry, continue in a COVID-19 situation. The same is true for a medical exam. The EEOC said, look, the medical exam rules are the medical exam rules. Sciotti just went over those a few minutes ago, and they are the same, even though we are dealing with COVID-19. One of the things, to give you a little more guidance, what is a medical exam? I gave you a list, I think, in the last section. How do you determine it? Because sometimes it's not obvious. Here are the factors: whether the test involves the use of medical equipment, whether it is invasive, whether it is designed to reveal the existence of a physical or mental impairment, whether it is given or interpreted by a medical professional. All those factors go into whether it's a medical exam or not. The disability-related inquiries and medical exams, we have the 3 phases: the pre-offer, the post-offer, pre-work, and while they're working for you. What has the EEOC said about that COVID-19? They've adopted it. They said, look, all 3 of those situations remain the same. The ADA rules do not change in that regard. And during employment, we are dealing with job-related and consistent with business necessity. Now, don't overthink this. As long as you as an employer have a good faith reason for making the inquiry, you're usually in good standing. Where we see employers get in trouble in reasonable accommodations, they ask too broad of a question, like the prescription med question that implicates Viagra and birth control. We've had employers that don't rely on good common sense information. They go to some website or they look something up on Wikipedia and said, hey, that must be the case. No, that's probably not a good idea in that regard. Generally a disability related inquiry or medical exam is job related and consistent with business necessity if you have a reasonable belief that their ability to perform an essential function will be impaired by the medical condition, or they pose a direct threat. And that is the same rule that we went over earlier. Objective evidence, it's based in reality. It's based on maybe something off the CDC's webpage. Maybe it's based off something on the New York State Department of Health's webpage. Print it out, all right? Those web pages change in that regard. And you want to make sure you know what your proof is, where you got it from, and basically justify it later on. Remember, when dealing with any medical inquiry, it goes in the medical file. You have to keep all medical documentation separate and apart. The EEOC has not relaxed any of those rules because of COVID. Direct threat, it's clear that the pandemic rises to the level of that. and they've analyzed all this already for us and said, COVID-19, we are in a direct threat situation. The threshold has in fact been met. What does that mean practically for me, Mike, as an employer? I think it means you can ask your questions. That's how I am interpreting it. An employee can't be play coy with us. Why weren't you in? The employee can't call the question or can't say, I have a fever and I have these other 3 symptoms, and then the next day want to come back to work. We can say, time out, go get medical clearance. Not that you're getting a COVID test, but you're getting medical clearance to return to work. An employee can't skirt the New York State executive orders, violate them, and then expect you not to act on that. You can fire them for it. When barbershops were closed, we had a rash of employers where the employee got COVID by going to one of these underground, salons or underground barbers, and they were doing it, and they got COVID there. These employees were fired for violating the New York State executive order. The other thing we're seeing, and I haven't mentioned this yet, we're seeing some employees lie on the daily screening forms. This is remarkable to me. They have symptoms and are saying no. The one scenario is they're lonely and they want to come to work. The other scenario is they need the money. They don't quite understand how the leave laws are operating, and that they would get paid for basically staying at home. And they're doing it. We had one right out lie, and then all of a sudden, the way it was explained to me, a COVID illness can hit very quickly. So 1 second the employee is fine, the next second the employee was on the floor. EMTs get there within a few minutes. The employer is concerned, overhears the employee saying, "Yeah, I've been sick for a week now." And you go back and look at all the screening questions, and there's no indication that they were sick. The employee had COVID. All right. We fired the employee for lying on the screening forms. You're allowed to do that. So that is another form of abuse that we are seeing. They want to come to work. The CDC, Department of Health, you as an employer are expected to keep up to date with what is developing there, what the rules are. I'll make sure you do so. You want your conduct and the inquiries that you make towards your employees to be based on the best information that you have available. And that includes an obligation by you to stay up to date on the latest developments. The reasonable accommodation process continues to apply during COVID-19. It is the same reasonable accommodation process that I went over a few minutes ago. And the biggest one you are going to see is I want to work at home. Now, you will see individuals, you deny them the right to work at home, all of a sudden they're calling in sick a lot, or what have you. Well, I'll just work at home today because I'm sick. All right. They're scamming you, and you know it. No, get better. You're not working for us at home today. You can direct the employee not to do work at home while they're sick, even if they want to. And then you hit a leave bank, or maybe they have no leave bank left. And it's either unpaid, or we're going to look at the COVID-19 sick leave rules, both federal and state, and they're going to have to produce the documentation in that regard. The other thing that's going on here, which makes everything a little more difficult for everyone on this call, depending on the county you're in, the various counties have some counties have issued executive orders or Department of Health orders, Erie, Onondaga, New York County, and a whole host of others. all those rules are a little different, and we have to have a handle on exactly where your business is and what the local law says or local executive order says relative to COVID-19. Undue hardship is always a defense. The employee says, I want to work at home, but all the information the employee has to work on is in the office. It's not digitized. They don't have computer access from home. It's a supervision issue. They have to supervise people in the office. I don't think you can supervise effectively remotely using Zoom. Maybe some people can, but I think it's fair assumption that for an employer to say, no, you can't do that. That's where the job description becomes very important to make sure that when you hit home the supervision aspect. Can I change a job description in the middle of a pandemic? Absolutely, folks. No problem whatsoever. Okay, so undue hardship, I mentioned enough of. The last thing, and I'll spend about 10 minutes just going through this. The EEOC prepared us some information about the pandemic generally and pandemic preparedness. Some of it, we're in one, so we're in phase 2. We're going to be in one afterwards. The one before, not really helpful to us at this stage, but I'll go through it anyways. Pre-pandemic, they recommend that you have a pandemic coordinator. The team should include staff experience in EEO laws, and basically it's preparing for a pandemic. Believe it or not, some of my employers actually had this in place. I was impressed. Most of us did not. Let's be honest. None of us were really prepared for what occurred here. Before a pandemic occurs, may I ask an ADA covered employee, do they have any compromised immune system or chronic health conditions that would make them more susceptible in the event of a pandemic? No. Asking an employee to inquire about compromised immune system or chronic health condition is a disability related inquiry, and without the objective evidence, you simply can't do it. When you're in a pandemic, absolutely you can make this inquiry. Are there ADA compliant ways where you can get this information? Yeah. You can structure a survey, and the answer need not be given anonymously. So I've given you a pre-pandemic survey that you're allowed to ask your employees. I'm not going to go through it because practically speaking, we're much farther down the road in that regard, but you can take a look at it. Can I require new entering employees to have a medical exam if I do it for everyone in the same job classification to inquire about their general health status? Heck yeah. That's been the ADA rule for years. Please remember, you have to do it for everybody, and you have to have the medical segregated in that regard. May an employer rescind a job offer based on one of these medical exams if the exam reveals that the person has a medical condition that puts them at increased risk of complications from COVID-19? No, unless we're dealing with a direct threat in that regard. The finding of direct threat and the ability to safely perform the essential functions of the job, we consider the risk, the severity, and the availability of reasonable accommodations to reduce the risk, all individualized criteria in that regard. May an ADA covered employer send employees home if they display COVID-19 like symptoms? Of course you can. You can tell them not to come in, or if they get sick while we're there, send them home. And if they get sick while at work, make sure you have in place a procedure I don't want you running all over the office. If you are sick, call so-and-so and we will escort you out of the office. That should be part of your pandemic plan at this point. During a pandemic, how much information may I, as an employer, request from an employee who reports feeling ill at work or who call in sick? You may ask employees if they are experiencing COVID-19 like symptoms. You can be very specific, ask them one at a time. If COVID-19 becomes severe, the inquiry, even if disability related, will rise to the level of direct threat. Guarantee you we're there, no ifs, ands, or buts about it. May I take employees' temperatures to determine if they have a fever? Oh yeah, the new normal. Of course we can. 6 months ago was a maybe, and now it is a definite. When a employee returns from travel during a pandemic, must the employee wait until the employee develops symptoms to ask questions about exposure to COVID? No, you do not. Remember, we have in place all these executive orders in that regard. Comply with them, ask away in that. Can I have them work at home? And again, we've gone through various iterations of this question. Of course you can. And then we have people you want to work in the office. Remember, you can make them work in the office. Remember your job description. If they can do 80% of their work in the office and 20% at home, encourage them to do the other 20% at home. Telework is always available. If there is no telework for them and you don't have work for them in the office, it's called a layoff. You lay them off and they'll get their unemployment. Can I have infection control policies, about washing hands, wearing masks, using hand sanitizer? Yes, of course you can at this point, and you are required to. The same with the personal protective equipment in this regard. During a pandemic, must an employer continue to provide reasonable accommodations for employees with known disabilities that are unrelated to the pandemic, barring an undue hardship? Yes is the answer to that question. You must continue to provide, and you have to evaluate the undue hardship. During a pandemic, may I, as an employer, ask an employee why they have been absent from work if the employer suspects it's for a medical reason? Yes, you are always allowed to ask, why weren't you at work today? And given what we've gone over here today, you are allowed to either tell them to remain at home, not work. You're allowed to tell them you can't work at home. You're allowed to tell them we need a medical release of some type for you to come back to work, given maybe where you went, given maybe the conditions, or maybe both. Remember, there's a lot here as far as this being a powerful tool for you as an employer. The doctor's note, I think the answer is yes. I just want you aware of the reality of the doctor's note, that sometimes there is no, they're backed up. I think the backup is a lot less than it was prior, and so you're not going to have any issue there. So yes, you can recover, request the medical note. Okay, I believe that is the last slide. There's nothing else is advancing. I'm going to take a look at a second at the questions. But please remember, the big thing I want you to do here is call them out. The abuse is there. It may just be they're home sick for a day, or they did it a Friday or Monday. They're going to want to work at home. And I'm sure you've come across other situations. And if you want to put them in the chat box, I'll happy to go over them with you. So let me go through some of the questions that have been posed here. Do we have to accommodate off-site working due to school of a young child when there is an older child at home too? The ADA will have nothing to do with accommodating the schooling issue. That will be an issue under Family First coronavirus. The ADA will not compel you to accommodate someone because of the schooling issues associated with the child. The U.S. Department of Labor has issued guidance on this under Families First when you have to accommodate, and they've posed a series of Q&As out there on that. If you would like me to email that to you, I don't have it in slide format to go over. I'm happy to. It's a short email, and the link I will send you will go right there. So if you want the information on accommodating school children because of they're not in school, shoot me an email and I'll send you it's recent guidance that was issued by the U.S. Department of Labor. How does this relate to the new New York paid sick leave that states that you cannot ask questions when they call in sick? The law itself on the paid sick leave will go into effect on January 1 of 2021. The accrual is starting on September 1. We're going to have to work through those issues, to be honest with you in that regard. I think it's going to present somewhat of a problem for us. If it qualifies under Family First Coronavirus Response Act, and you're going to be able to ask for documentation under Families First, as long as there is a law that says you can make the inquiry, you can ask for the documentation, you're going to be able to do that. On the email, send it to me by email and I'll just respond to you. Don't put your email address in here because I think the chat might go away on me when I'm all done. So just email me. My email is on the first page of the PowerPoint. I'll just respond and drop it to you, or Candace, I'll just send it to you and you can send it to everyone else.
That works.
All right, so another question that's popped up. What if an employee lives in PA but works in New York? Travel to a state on New York travel advisory, but that state is not on the PA travel advisory. Should we allow them to return to work, or should we quarantine them for 14 days? I haven't seen the scope of a PA travel advisory. I think if you were to quarantine them, it's probably going to trigger, or tell them to go through the 14-day quarantine. It's probably going to trigger the New York State COVID-19 sick leave law, and you might have to wind up paying them for the part of the 14 days that they have to work. As an abundance of caution, no one's going to fault you for following both the state and Pennsylvania advisories in that regard. Okay, I think those are the three questions that I had. You know, again, don't be afraid to ask, why aren't you here? Call them out. Reasonable accommodation sort of sets the guidelines for you, what you can ask, what you can't ask. We do have to work through the one question on the New York State Paid Sick Leave Act. The next webinar I'm doing for the chamber, I think it's the end of this month, is going to be on the Paid Sick Leave Act. And we're going to have to sort of figure out between now and the first of the year what New York State is going to allow, what they're not going to allow. We suspect there will be guidance and additional regulations coming from the state of New York on the paid sick leave, which will hopefully answer the gap questions or the pandemic questions that have been posed here in that regard. So we'll see and stay tuned later this month for that other presentation. So with that, I'm going to end it. I wish you all a happy Labor Day. Enjoy the extra day off. And if you have questions, feel free to email me and I will answer them as quick as I possibly can. So thank you, everyone. Candace, I'll turn it back over to you in case you have comments. I will email Candace the guidance I mentioned, and she can flip it out to all of you, and then you can see it.
Yes, that's great, Michael. I'll send a follow-up email to everyone later today that will include the link of the recording from today's presentation and all of the other information. If anyone has any questions, as always, feel free to reach out to us at the chamber here, and we'll have Michael's contact information for you in that email as well. We'll just end it there. Thank you for your presentation, Michael, and thank you for everyone for joining us today.
Take care, everyone. Bye-bye.